Principles of EKG Part 2. The following are the objectives we will cover in these PowerPoint slides. Artifacts are unwanted, erratic movements of the stylus on paper caused by an outside interference. EKG is extremely sensitive to any kind of nearby electrical activity. There are 4 types of artifact. There is wandering baseline, which is usually due to the patient moving or poor electrode placement. Somatic tremor is caused by muscle movement from patients with either severe pain or Parkinson's disease. Alternating current or AC interference is from other electrical devices. Interrupted baseline occurs when the electrical conduction has been interrupted, such as an electrode falling off. Normal appearance of an EKG complex. There are P waves, QRS complexes, and T waves clearly present. Do they have consistent appearance, and do they occur at regular intervals? Are any odd beats present that do not fit in with others? Is the rate normal, fast, or slow, and is the rhythm regular or irregular? Rate is calculated heart rate from the EKG recording. Count the number of P waves in a 6-second strip, 30 large squares, and multiply it by 10. Or count the P waves in a 3-second strip, 15 large squares, and multiply by 20. You can also count the number of squares in between the R waves and then divide by 1500. 1 minute on an EKG strip passes 1500 small boxes. To get ventricular contraction rate, we count the number of complete QRS complexes that occur in 6 seconds and multiply it by 10 to get a greater number of ventricular contraction in 1 minute. Rhythm. Rhythm is a patient's heartbeat that is either regular or irregular. If patient's heartbeat is regular rhythm, each cardiac cycle occurs within the same time frame. An individual cardiac cycle occurs exactly the same length of time apart. Measure the difference between the 2 consecutive RR intervals of the ventricular rhythm. Measure the distance between the 2 consecutive PP intervals in the atrial rhythm. Analyzing the EKG strip. So the rate and the rhythm strip is lead 2, which is the whole bottom part of the EKG. P waves, there should be 1 P wave before each QRS complex. Each is a positive deflection and similar in size and shape. Intervals assess the duration and distance. Appearance of the segments and waveforms. Are rhythmic PQRST cycle present? Are there any abnormalities such as more than 1 P wave, QRS segment without a previous P wave or an elevated ST segment? All these abnormalities should be brought to the physician's attention immediately. There are 4 broad categories of arrhythmias that can be noted on EKGs. There is sinus arrhythmias, atrial arrhythmias, ventricular arrhythmias, and biochemical arrhythmias. Sinus arrhythmias are pathways of electrical charge is normal, but the rate and rhythm of the heartbeat is altered. Sometimes the SA node fires too slowly in this instance. Here's where we see abnormalities in the sinus arrhythmia. Oftentimes patients will complain of palpitations, fatigue, exercise intolerance, and dizziness. Atrial arrhythmias, or PACs, or premature atrial contractions, are not abnormal, but are of concern if they are regular and occur more than 6 times per minute. They cause a faulty electrical impulse formation or conduction defect within the atria. The premature atrial contraction can appear on EKGs as an abnormally shaped P wave or an extra P wave. Atrial flutter occurs when the atria beat at an extremely rapid rate, up to 300 beats per minute. And this can be atrial flutter or atrial fibrillation. Typically, atrial flutter and AFib, usually you will not see a P wave at all. So here is atrial flutter, and there is no real pronounced P wave before the QRS. Atrial fibrillation is more where we do not see the P wave at all. There is no distinct increase in the baseline. You will also see that there is an irregular distance in between the QRS complexes within atrial fibrillation. Premature atrial contractions is where there is an abnormal distance between the QRS complexes. As you can see here, there is a shorter distance than versus this longer distance in between the QRS complexes. Ventricular arrhythmias. Your first one is a premature ventricular contraction, which is noted by this severe depression in the ST wave. Ventricles contract before they should, and there is an absence of P wave or an abnormal T wave, and oftentimes there is a widened QRS complex that follows as such, pointed here. B has a few V ventricular tachycardia waves here, seen in 3s. And C is a full-on stretch of ventricular tachycardia where the ventricles beat extremely rapid rates, which usually reflect a pathological state such as a coronary blockage. This can lead to cardiac arrest, unconsciousness, and death. What happens is the heart has no time to recover and repool blood to pump out adequate amounts of blood. Some patients may be asymptomatic, but most will have shortness of breath, chest pain, and dizziness. Ventricular arrhythmias continued. So on top, which is D, is ventricular fibrillation, which is the most critical and life-threatening, which quickly results in death. It is important to grab a physician as soon as possible if you see this on an EKG monitor. Here in E is an example of asystole, where a heartbeat has ceased. Biochemical arrhythmias can happen from certain medications or a lack of or too much of a certain electrolyte. Digitalis is the most common cardiac drug that is used to slow and strengthen the heartbeat. Too much can cause or prove a toxic effect and can cause changes in the EKG. Potassium is a critical mineral for normal cardiac function. Too much potassium or hyperkalemia or too much or hypokalemia can cause life-threatening arrhythmias and can be seen on EKG. Usually there is a dip between the right before the T wave, or a slight or abnormal elevated T wave. Pacemaker rhythms. Sometimes we will do EKGs on a patient with a pacemaker, not commonly. You will see, if they do have a pacemaker, you should see the pacemaker spike as such on an EKG. Implanted cardio defibrillators, they deliver a shock if ventricular tachycardia or VFib are present. They are what we call a cardioversion that happens when those abnormal rhythms happen, and it's designed to reset the heart rhythm. Coronary vessels. So here's a picture of our coronary vessels again. During an MI, the heart muscle becomes ischemic because blood supply has been interrupted. So changes in an EKG from an MI. So in a hyperacute phase, the T wave gets real tall. In the early acute phase, you will start to see the elevated ST segment. This is a very pronounced elevated ST segment. A lot of times it will just be 1 millimeter box. And then in the later acute phases, the elevated ST segment becomes more prominent, a little bit higher as it is indicated here, and then the T wave will be inverted. A fully evolved phase is an even higher ST elevation and an inverted T wave. The healed phase or stabilized chronic will look like this. That depression right after the QRS typically does not happen anymore, and a lot of times you will still see inverted T waves on chronic or stabilized patients who have had an MI or some ischemic process to the heart. Stress tests are tests that we often perform on patients to record the patient's cardiovascular response to measured exercise challenges. They diagnose cardiac disease that cannot be detected by a standard resting EKG. They determine an individual energy performance capacity. They prescribe a special designed exercise plan, and it is important for us to be prepared to terminate testing immediately if a patient is unable to continue due to abnormalities seen on the monitor. There are a couple different types of stress tests that are commonly ran today. We have the Lexiscan Sestamibi and the exercise Sestamibi. Both of them are nuclear medicine components. What happens with these tests is they have an initial scan of the heart at resting. They are given a nuclear isotope that highlights the heart, and we do imaging. Then after that is completed, the patient will do the exercise portion. Lexiscan is the medication that is given to a patient who might not necessarily be able to walk on the treadmill. It will exercise the heart for them. And if a patient is able to exercise, we will put them on the treadmill and for a given time until they reach their predicted heart rate. Then we have the stress echo and the dobutamine echo. These stress tests are done with an echocardiogram. What we do is we do resting images of an echo prior to the stress test. Then we will have either the patient exercise on a treadmill, or we will give them a medication such as dobutamine to exercise them if they are unable to walk. And then what happens after we reach a certain exercise tolerance or that predicted heart rate, we will then do another set of images by echocardiogram. After those second set of images are done via nuclear medicine and echocardiogram, we then compare the resting prior to versus post exercise and see if there is any differences or lack of oxygen being supplied to the heart muscle. A lot of times patients will get nauseous and vomiting, so it is important to be prepared for those types of situations. We've also had vertigo, syncope while on the treadmill, so it is important to have gait belts and proper staffing when running these tests. Holter monitors are a portable system of recording a patient's cardiac activity for a 24-hour period or longer. Usually we do Holter monitors for 24 to 48 hours. It is said that if you cannot record the abnormality within that time period, a King of Hearts or an event monitor needs to be placed so the patient can just press the button when they have the event. Patients must keep a detailed journal of stressful events while wearing it. You may fit the monitor on the patient and explain the procedure, and then also you will have to remove the monitor. Sometimes patients will remove them on their own. Recording is uploaded for analysis and can be printed for further study. Cardiac event monitors record device that is worn up to 30 days to catch events such as vertigo, weakness, or palpitations that might not always be present on a daily basis. Patients trigger recording when they feel any indication of the cardiac event. Patients must be taught how to remove and reapply electrodes to remove during bathing. And patients should be provided with details on how to conduct daily life while wearing it. You want them to go about their way. You don't want them to just sit around and wait for the event to happen. These types of monitors are often called memory loop recorders or King of Hearts to most cardiologists and physicians. Heart scans. Oftentimes we are doing specialized types of CT scans called electron beam tomography that are very specific to the heart. We give a dye that is specifically allocates to the heart and highlights it. Screening tools that allow physicians to see the amount of plaque in coronary arteries by showing the presence of calcium deposits. Now there are tests being done as a screening called a calcium score that will help determine your risk factors for cardiac problems in the future. Patient education. Talk to patients about risk factors that can be changed or modified and encourage any attempt by the patient to make these changes to reduce the risk of cardiac disease. Visual aids like brochures and posters encourage learning. I worked for a physician that was a cardiologist, and he had a card with his picture on it, and it highlighted his interests and that sort of thing and where he went to school. And he told a patient to hang that card on close to the handle on the refrigerator. So every time that patient looked at his face when he opened the refrigerator, it would remind him to eat something healthy. So just those little things that help patients in that daily reminder. No educational items used with the patient into the medical record. That is very important that we educated them and note that. Legal and ethical issues. It's ethical obligation to complete the EKG as accurately and carefully as possible within a timely manner. We don't want you taking 20 minutes to do an EKG. It should take you no longer than 10 minutes. I know at the Marshfield Clinic here in Wausau and in Marshfield, they are doing EKGs every 10 minutes. To assume full responsibility for accuracy and precision for each test that you perform. And this concludes part 2 of the EKG lecture.